Hello, my name is Tally Wells. I am the new Executive Director of the North Carolina Council on Developmental Disabilities, and I want to take a few moments to tell you 10 things you need to know during this COVID-19 crisis. If you are a person with a disability, if you have a family member with a disability, or if you work with or care for someone or support someone with an intellectual or developmental disabilities. This is a critical time for our state, for our country, and for our world. The North Carolina Council on Developmental Disabilities wants to be a resource for you and your family and your loved ones during this crisis. The most important thing is that we all do our best to keep each other safe. Take social distancing seriously. This means stay a full body length, stay a full 6 feet away from other people as you need to go outside or encounter other people. This is hard to do, and I realize that, but it's so critical because it's not about making sure only that we aren't infected. But if we become infected and we have to go to the doctor and we have to see a nurse or a direct support professional, we could spread it to them. They could bring it back to their family, and this could really spread even more. North Carolina has done as well as any state that I'm aware of in keeping the number of COVID-19 infections to as low a number as possible. There are still lots and lots of people suffering in North Carolina, but the more we do to protect ourselves means the more we do to protect others. So let me get into the top 10 list. Number 1, the first place you should be going to for information is the North Carolina Department of Health and Human Services website. You can find that website at ncdhhs.gov. ncdhhs.gov. That has the most up-to-date information about COVID-19 and what you may need to know about your particular situation. It has the health care updates, the daily updates. It has the most information, and it's the first place you should go. Second, at the North Carolina Council on Developmental Disabilities, we've done our best to update our website with as many resources for self-advocates, for people with disabilities, for family members, for direct support professionals on COVID-19. So the second place you should go is to our website, NCCDD.org. NCCDD.org. Go to our website. We've got self-advocacy tools. We have plain language information. We have information for direct support professionals. We have information for families. And we have as many of the updates on conference calls and webinars. So you can find the resources in a different way than you can find them at the DHHS website. And we do have some different resources, so you want to go to both websites. Third, the federal government has approved North Carolina's request to make changes to the innovations waiver and other Medicaid waivers during this crisis. Here's what that means for you. Your family member may be able to provide services to a person with an intellectual or developmental disability. Or if you're a family member, you may be able to provide those services and get reimbursed for those services. There's going to be a webinar on Tuesday that the Department of Health and Human Services is doing. We will put as much information on our website up about this. The department is also creating a frequently asked questions about changes to the Medicaid waiver. So look to our website and the NCDHHS website for information. Fourth, the Department of Health and Human Services is holding weekly phone calls for family members and people with disabilities who receive services through LMEMCOs and through DHHS. We put information when we know about it, about the time and date of those conference calls on our website and our social media, so check regularly. Fifth, the federal government will be sending checks due to a new law that was passed called the CARES Stimulus Act. The federal government will be sending checks in the amount of $1,200 to most people across the country. There will be some people who will not receive these checks. For instance, if you are a dependent of a family member, you might not be able to receive the check, but most people will receive the check. The check should not impact your Medicaid or SSI, but it's best in your individual circumstance to talk to a benefits counselor. We have information about benefits counselors and how to contact them on our website. Also, there were changes to unemployment benefits. More people are able to receive unemployment benefits, and they may actually receive a higher amount of unemployment benefits. You definitely want to check with a benefits counselor and research if this will have any impact on SSI or Medicaid. Again, we have information about benefits counselors on our website. Sixth, if you are an individual with an intellectual developmental disability, or you have a loved one who is, and they become sick, they can bring their support person with them in the ambulance or the hospital if they need them. We have information about this on our website. Seventh, it's important to make an emergency plan. If you become sick, or your loved one with an intellectual developmental disability becomes sick, or their caregiver becomes sick, make a plan now. Talk to your provider, talk to your LMEMCO, talk to your care coordinator. Make a plan for who's going to provide services. There is guidance on the DHHS website for those providers who provide services in home settings. You can also read that even if you're not a provider. Again, it's on the DHHS website. We are also requesting guidance for individuals with disabilities and their family members to get on the website. But also, there are those weekly phone calls where you can ask the questions that you may have about your current situation. Eighth, we've created a survey because we want to hear from you about your experience with COVID-19. If you're a person with a disability or a family member, you can go to our website to fill out the survey because we really want to hear from you as to what your experiences are during this crisis. We will be bringing your experiences and your concerns to state leaders as we read them and hear them. Ninth, the North Carolina Council on Developmental Disabilities has made $75,000 available in many grants where organizations can apply who serve people with intellectual and developmental disabilities to fill any gaps in services or to meet the needs, whether they're recreational or emotional or otherwise, of people with intellectual and developmental disabilities. The grants are for between $500 and $3,500, and you can find information on our website. And finally, number 10, the governor has issued an executive order that utility providers cannot disconnect utilities during this crisis. You want to go to our website and read the executive order for the exact length of time that this order is in effect. You also want to check back regularly to see if the order is extended. Now, if you are able to pay your utilities, you should pay your utilities, because this order does not mean that you do not have to pay your utilities. It just means that if you're not able to pay your utilities will not be cut off. You will, at some point, most likely be required to pay these utilities. Finally, I want you to know that all of our council members and all of our staff at the North Carolina Council on Developmental Disabilities are doing everything we can to keep you updated with information and to be bringing your concerns to state leaders. We are thinking about you. We are concerned about all people with disabilities across our state. And I can't wait for a time where we are allowed to meet in person again, and I can meet each of you as we travel across the state to do listening sessions. We're calling them Conversations with the Council, and we will be holding them across the state once this COVID-19 crisis has ended. Thank you, and take care of yourself.